Hello, my name's Briggs.
And I'm Ms Viggers and we're Directors of Quench Arts.
This video is going to look at how we recruit participants to the Wavelength project and also our partnerships.
When we're looking at recruitment for the project participants, what we've done is we've built up a whole range of referral networks to the programme, and we've got a very simple application form that's being disseminated to our partners for them to pass on to their staff, and for them also to then the staff to pass it on to children and young people that they work with. And it's a very simple application form whereby young people can detach a small part of the flyer, send it in with their contact details and just to say that they're interested in the project. And that's the first stage of our recruitment process. And it can be, the information can be emailed if people prefer, or they can ring us up, but we've also got a free post address, so it doesn't cost the young person anything to send that in. And on that form they give their own details, their name, their address, their age, but also the details of their parents or carers and their key workers if they've been assigned a key worker, like a community psychiatric nurse, for example. So that enables them to go to the next stage. We know that the young person themselves is interested, and we can then approach the young person to come to meet us at our project venue so that we can see a little bit more about them and their need and their musical interests, but also so that they can gain some confidence in terms of who we are, what the project's about and what they'll be committing to, and have more of an understanding about what they'll be involved with, feel a bit more confident about coming to the venue, who they'll see at the sessions, because obviously we tend to go to most of the sessions ourselves. And we can make sure that we place that young person with the most appropriate music leader for their interests.
The next stage is that we then gather some more details for an individual risk assessment. This is from their support worker, so it could be a mental health support worker, it could be their GP, so that we can actually meet the individual needs of each person. This is kept obviously confidential, and we tell the music leaders certain information that would be helpful for their planning.
Things such as any trigger points for the young person, anything that the young person might have in terms of helping them to access sessions better, so if they've got any particular allergies or things they don't like or things they're particularly concerned about, then we can build that in to the project, and also any support needs for that young person as well. So we've touched upon some of the partners involved in the Wavelength project, but we'll give you a bit more of a run through of all of the range of partners that we've worked with through the programme. So the first partner really is Birmingham and Solihull Mental Health NHS Foundation Trust, and they've provided referrals to the programme through their Solar mental health team that works across Solihull, and they've also supported the training element of our programme by allowing us to deliver training through their recovery college for their staff and also for parents and carers. As with most partners, they provided strategic support on the project by allocating members of staff to our project steering group, and that's helped us develop the project further to address any challenges and to look at a sustainability strategy for the programme. They've also provided some match funding for the project as well. The second main partner, I guess, other than delivery partners, is Forward Thinking Birmingham Consortium, the lead partner of which is Birmingham Children's Hospital. And they now, from the second year of the programme, or halfway through the first year actually, they actually run the mental health provision for children and young people in Birmingham, and that's up to the age of 25. So we've received referrals from Forward Thinking Birmingham hubs, their teams, and also their Pause drop-in centre to our Wavelength programme, and again we've had strategic support from them on our project steering group.
We've also worked with Arden Forensic CAMS and Birmingham Children's Hospital Parkview Clinic on the programme. Both of those are inpatient settings, and because the young people that are on those wards can't actually attend our community programme, we have actually provided them with some holiday provision, so they have also had some involvement in tailoring those sessions in their settings so that they're the most appropriate for the young people there. They've both been very much involved in the programme by sitting on our steering group and also in advertising all different opportunities to their young people. The next three partners are Birmingham Music Education Partnership, in particular Services for Education, which is the Birmingham Music Service, Solihull Music Education Hub and Matt Makes Music. Those three organisations have all sat on our steering group. They've all helped disseminate the project information to all of their schools, their pupils, the young people that they work with. And additionally, the Birmingham Music Education Partnership have provided match funding for years 2 and 3.
And they've got a real interest in the programme as well, in terms of widening their reach and making sure that they're providing opportunities and disseminating information to support musical inclusion, so that every child and young person can have access to music making opportunities and musical progression.
Solihull Engage, which is part of Solihull Council, have actually provided us with a venue in kind for our songwriting sessions once per month, so that we can actually deliver some activity in Solihull, not just in Birmingham, to aid those people who travel long distances.
And we've also had a partnership with Stonham Home Group, who've provided a support worker to lead sessions with parents and carers alongside the project group sessions. So that support worker provides support and strategies to parents, and also gives them some signposting to other opportunities and other provision out there that will be beneficial to them. In terms of the young people that we've had involved in the programme over the 3 years, we probably initially thought that we would have more of a focus on early intervention, but actually that's not been the case, and we've received referrals right across the range of the mental health kind of teams, if you like. The types of conditions that young people have had who've been involved in the programme have included things like anxiety and depression, eating disorders, schizophrenia, bipolar disorder, and behavioural disorders like ADHD. But some young people have had multiple needs, so we've had some young people who've had a mental health condition as well as a physical disability. Some have had a learning disability, and some have been on the autistic spectrum as well. Some have been young carers, looked after children, and some have actually come from families who have a history of poor mental health within the family, so mum or dad might have periods of being unwell as well. Poor mental health may have manifested itself in other ways. For example, some of the young people that we've worked with may have self-harmed in the past. We've already said that they may have missed quite a lot of school. They may potentially have been in trouble with the police, or even have attempted to take their own life. Nearly always, having a mental health condition has affected the young people's self-esteem, their self-confidence and their social interaction. Now sometimes, or in the majority of cases, young people's self-confidence is deflated. They have a very negative view in terms of their abilities and what they can offer to the project or in life in general. But sometimes they actually have an inflated opinion of their own musical experience and ability. Now, taking part in the Wavelength project allows participants to meet other young people who've got an interest in music of all different levels of musical experience, and so it really does enable the participants to potentially reassess where they are in terms of their own skills and what they can offer. And that's actually a really positive thing, because it can inspire musicians to look at how they can progress through the project if they initially thought that they were incredibly talented and had nothing else to learn. But it can also help young people to feel that they've actually got a lot to offer if actually they realise that they have got a lot of musical skills and a lot of musical talent and musical ideas that they didn't otherwise realise that they had.